Ever imagine a surgery that, like, leaves almost no scar? Or using sound waves, can you believe that, to actually guide a procedure inside the body? It's kind of mind-blowing, right? Surgical tech is advancing so fast, and we're breaking it all down for you today.
It's true. We're diving deep into innovations in surgical techniques and patient management, and let me tell you, it's light years ahead of where we were even just a few years back.
Seriously incredible. We're basically getting a sneak peek into a professional surgical podcast. Like, we're eavesdropping on these expert surgeons tackling 12 crucial questions. It's all about the latest techniques, the really tough cases, the works.
Think of it as a crash course on what's new and important in the OR, distilled down to the essentials.
Exactly. And one thing that really struck me was how much emphasis there is on these minimally invasive procedures. I mean, obviously, smaller incisions make sense, but this is a whole other level.
Absolutely. And it's not just about, aesthetics. Minimally invasive often translates to quicker recovery, less pain, getting back to your life faster. It can really make a huge difference for patients.
So true. This isn't just about making things easier for the surgeons, it's about tangible benefits for the patient. Like one example that blew my mind, minimally invasive esophagectomy for esophageal cancer. We're talking about operating on the esophagus through these tiny incisions, cameras, special instruments, no more massive cuts.
Total game changer, especially with how complex esophageal surgery can be. Think about the benefits: less time in the hospital, less pain afterwards, and a much smoother recovery overall.
All right, get ready for this. Removing the thyroid gland through the mouth. I thought this was sci-fi, but it's real. It's called transoral thyroidectomy.
Wild, right? But it just goes to show the constant drive towards less invasive options. Now, it's not for everyone, so choosing the right patient is key, but avoiding that neck scar, huge plus for a lot of people.
You bet. But here's the thing, less invasive is great, but what about precision? Which leads us to our next theme, these technologies that are basically like having X-ray vision during surgery.
Seeing inside the body in real time is transforming how we do surgery. Take intraoperative ultrasound during liver resections, for example. It lets surgeons see the liver's structure, blood vessels, even tumors, all while they're operating, like having a roadmap right there inside the body.
So they can get the whole tumor without damaging healthy tissue, leading to a better outcome for the patient. That is incredible. And speaking of precision, the source also talks about sentinel lymph node biopsy, a less invasive way to check if breast cancer has spread compared to axillary lymph node dissection. Can you break that down for us?
Of course. So instead of taking out a whole bunch of lymph nodes to see if the cancer spread, surgeons can now pinpoint and remove just a few key ones, the sentinel nodes. This method not only gives a more accurate picture of the cancer stage, but it also drastically cuts down the risk of lymphedema, which is that painful swelling in the arm that can be really debilitating.
So it's about getting a more precise diagnosis and treatment plan and minimizing potential complications. Win-win for the patient. It's amazing how these developments directly translate to a better patient experience.
Exactly. These technologies, they're not just fancy tools, they represent a major step forward in patient care.
Now, not all surgical cases are straightforward. Let's talk about how surgeons tackle some of the toughest situations, the ones that require quick thinking and serious expertise.
Absolutely. These complex cases, they really highlight the skill and adaptability you need in the OR. For instance, the source discusses traumatic brain injury and the importance of a procedure called decompressive craniectomy.
Tell me more about that because brain surgery just sounds incredibly delicate.
Oh, it absolutely is. You see, when the brain swells after a traumatic injury, it can create dangerous pressure inside the skull. Decompressive craniectomy involves removing a part of the skull to relieve that pressure. It gives the brain room to swell without causing more damage. It can actually be life-saving in these critical situations. And it's not as simple as just, opening things up. Deciding to do a decompressive craniectomy is a big deal. It's based on things like how conscious you are, what your CT scans look like, all sorts of factors.
So many things to consider, and the surgeon's expertise is crucial. The source material also mentioned chronic pancreatitis, which I know can be incredibly painful. And sometimes surgery is an option, but like as a last resort, right?
Right. Chronic pancreatitis is really tough to manage, and surgery isn't a magic cure. But when the pain is just unbearable and nothing else has worked, it can be a way to improve quality of life. The source actually talks about a few different surgical approaches, each with its own pluses and minuses. For example, there's pancreaticoshedionostomy, which helps with drainage, or a Whipple procedure might be needed in more serious situations.
So finding the approach that fits the specific patient, no one size fits all.
Exactly. And then sometimes there's no time to plan at all. Emergencies, like a perforated duodenal ulcer, They need action, fast.
Okay, break that down for me a bit. What's actually happening in that situation?
So a perforated duodenal ulcer, it's life-threatening, really. It means there's a hole in the wall of the duodenum, which is part of your small intestine. Needs immediate attention, and surgery is often the only way to close that hole and stop things like infection from taking hold.
It's incredible how surgeons stay so calm under that kind of pressure.
Right.
Really highlights the skill and expertise needed in the OR.
It really does. But as we've been saying, great surgical care, it's not a one-person show. It takes a whole team, everyone working together.
Right. The source really emphasizes that it's a holistic thing, not just about the operation itself.
Exactly. It's about the whole person, not just the surgical site. Like managing vascular graft infections. Those are serious complications, and treating them properly needs a team effort. You've got surgeons, infectious disease specialists, often other specialists too, depending on what the patient needs.
A whole team of experts. I love the example they gave about blood management in cardiac surgery. I mean, it seems obvious, but I had never really thought about it.
Blood management is crucial in those cases. Even losing a small amount of blood can have big consequences. So surgeons have a multi-pronged approach. Before surgery, they'll check for anemia. They might even try to boost your iron levels. During surgery, they use techniques to minimize bleeding, to help your body clot properly. And after, they're watching you closely, only using transfusions if absolutely necessary.
So minimizing the need for transfusions at every stage, which is obviously better for the patient.
Absolutely. And it's not just those acute situations. The source also talked about managing chronic conditions, like ulcerative colitis, which sometimes needs surgery too.
That's right. They mentioned a procedure, total proctocolectomy with ileal pouch anal anastomosis, or IPA for short. Had to look that one up, I'll admit.
Bit of a mouthful, right?
Basically, it involves removing the colon and rectum, and then they create a new pouch from the end of the small intestine. This pouch then takes over as the new rectum.
Sounds like a major procedure, but for someone with severe ulcerative colitis who hasn't responded to other treatments, it could be life-changing.
It really can. Allows for pretty normal bowel function and can significantly improve someone's quality of life.
It's really amazing to see how much these procedures have changed, and it makes you wonder, what does the future of surgical care look like? I mean, some of this stuff would have sounded like pure science fiction a few decades ago.
It's true. The speed of innovation is unbelievable. One area with so much potential is surgery and robotics combined.
Oh, yeah.
We're already using robots in different specialties, and as that tech gets even better, we can expect even more precision, smaller incisions, faster recovery times. Like something out of a movie, but it's becoming our reality. And it's not just about the robots themselves, it's about how we make these advancements part of patient care.
Exactly. Imagine AI helping surgeons during complex surgeries, making decisions in real time, or even customizing a surgical plan based on your specific anatomy. It's pretty exciting stuff.
Mind-blowing. And like we've been talking about throughout this whole deep dive, the future of surgery isn't just about the technical stuff, right? The source material we looked at really focused on the physical side of things, but we're learning more and more about how connected the mind and body really are.
It's true. As we understand that connection even better, I think we'll start to see a bigger focus on the psychological and emotional needs of surgical patients.
So going beyond treating the physical body and caring for the whole person.
Exactly. Imagine things like meditation, mindfulness exercises, maybe even virtual reality as part of getting ready for surgery and recovery afterwards, all to help reduce anxiety, manage pain, and help you heal faster.
A holistic approach that recognizes just how connected our mental and physical well-being really are. This deep dive has really highlighted how far surgical care has come, from minimally invasive techniques to tackling those really complex cases, and now this focus on the patient's overall well-being.
It's been a remarkable journey, and in a lot of ways, we're just getting started. It's this drive to keep innovating, to find better ways to care for patients, that makes it such a captivating field.
This deep dive has definitely given us a lot to consider. As we wrap up, what's the one thing you really want our listeners to remember about the future of surgical care?
I'd say this. The journey to better surgical care, it's a team effort. It doesn't matter if you're a healthcare provider, a patient, or just someone who's fascinated by medicine, your curiosity and engagement, it all plays a role in shaping the future of this field.
Such a great point to end on. Thanks for joining us for this incredible deep dive into the world of surgical innovation. And until next time, keep asking questions, keep challenging assumptions, and stay curious about the always evolving world of surgical care.